Well, we have a very informative start to our show today. It involves medical research and breakthrough technology that puts Colorado on the forefront of cancer research. Tomotherapy is a new way to deliver radiation treatment for cancer. It delivers a sophisticated form of radiotherapy that combines daily CT imaging and treatment delivery into one system. Now, it's a precise mode of treatment that targets the cancer and spares normal tissue. Very excited to welcome Dr. David Raymond, and he is, of course, in the Radiation Oncology Department at the University of Colorado. He's also a professor and director of Radiation Oncology at the University of Colorado. Welcome to the show.
Thank you very much. Thanks for having me.
This is a serious topic, and it's a pretty broad topic. But first, let's start by telling me more about the radiation department that you work in and what exactly it is.
Yeah, so the Radiation Oncology Department at the University of Colorado, it consists of 7 faculty members. We have a fully accredited residency program. We have an incredible support staff. You know, you hear the comment, it takes a village, and it really does. We probably have one of the most experienced support staffs in the entire state of Colorado in terms of being able to run radiation oncology here in the city and throughout the rest of the West.
But your department is really unique. Why is that?
You know, we're a very unique department because we all came from different areas of the country to help build this department in the last 10 years. I trained at Johns Hopkins. Several of my colleagues trained at Sloan Kettering, at Duke University, in a lot of very prominent places. And we had this vision of coming here and building this department, making us one of the top 10 radiation oncology departments in the entire country.
Why did you decide to get in this field in the first place, Doctor?
Well, I have an identical twin brother who's also in this field. We both grew up in North Carolina, and my father was head of radiation oncology at the Wake Forest University. And we saw how happy he was in this field when we decided to go into medicine. And it really combined a lot of unique aspects of being what we felt was a physician's all about. And that's really close contact with patients, getting to know them, getting to know their families, getting a chance to do something wonderful, treating cancer and curing it, getting a chance to go into the operating room and doing all sorts of specialized procedures. So it was really a wonderful opportunity for us when we saw our dad on a daily basis enjoying this field. So we both were drawn into it.
Saving lives.
Yeah.
That's wonderful. Tomotherapy, I mentioned that early on. Explain to me a little bit more what that means.
Sure. So tomotherapy is the ability to combine daily CAT scan imaging with the delivery of high-energy X-ray beams to treat cancers throughout the entire body. And this tomotherapy center that we have now established in this tomotherapy unit is very, very unique because it really allows us to begin to start to what we call deliver intensity modulated radiation. And that's just a fancy way of saying that we can actually now dose paint our radiation and imagine a palette of different colors, and we can palette or paint different doses of radiation, as you can see here on the screen, where you see the red blush of color. Imagine me taking a paintbrush and treating, that's the high dose of radiation to that area, and then we get a very, very rapid fall off as you see the colors change. So we can spare so much normal tissue around that area and still deliver extremely high doses we didn't think were possible 5 to 10 years ago.
This is exciting, especially for anyone who has family members or friends, and I think everybody knows somebody who's been touched by cancer, but to know that you can actually treat them like this, and it's not so tough on the body.
Well, the other reason we like the tomotherapy unit or this new type of delivery radiation is because we can actually image the cancer on a daily basis and image the normal anatomy. So for one reason or another, the patient's not set up the same way each day. It'll automatically realign the patient robotically, or we can manually do it. So we know every single day during the treatments that we're delivering precise treatments to that specific area that we want to take care of.
And you can actually size the mass and know
we can see it. We can see if it's changing on a daily basis.
That's wonderful.
And we can actually, what we call, adapt our radiation based on the changes of that cancer and the normal anatomy every single day.
Where else in Denver has this kind of treatment?
We are the only tomotherapy center in Denver right now, and we're very proud of the fact that we've really got this thing established and moving very quickly and forward. We're combining the newest types of other types of cancer care in conjunction with the tomotherapy center.
And what are the benefits with working with something like this? It's making a huge difference with patients, right?
It really is. I think what it allows us to do, for instance, I'll give you an example. We are one of the nation's experts in delivering what we call stereotactic body radiotherapy. And that's the ability to deliver super high doses of radiation, whereas normally we would treat in 6 weeks, we now treat in 3 to 5 treatments.
You're kidding.
And the tomotherapy center allows us to do it very, very accurately and precisely. In fact, Brian Cavanaugh, who's one of our radiation oncologists, writes the textbook on this type of procedure, and this is sold in countries throughout the world. We actually have a course where people fly in from around the country, including prominent places like Mayo Clinic, for us to teach them how to do this. And we deliver this type of treatment on the Tomotherapy Center.
Congratulations.
Yeah.
How long has this been around?
Well, tomotherapy was developed in the early 2000s, and it primarily originated at the University of Wisconsin. And we've kind of got the next generation of tomotherapy machines that are being able to deliver this pretty sophisticated form of radiation. You know, it's important to emphasize to people that that it takes a lot of work to be able to do this. And cancers, we wish there were all these easy round balls that we could treat, but they're not. They're very irregular. They stem out in different directions. And that's why we wanted the Tomotherapy Center, to be able to deliver these beams and conform it around these irregularly shaped tumors and still spare normal tissue.
There are so many benefits compared to the old ways of radiation.
Absolutely.
Okay.
Absolutely.
Now, tell me the facility that you've been talking about. Where is it located at?
So it is located in Lone Tree near Park Meadows. And it's part of the whole Anschutz Cancer Center. So we also have the Anschutz Cancer Center in the main campus at Anschutz off 225 in Colfax, and this is an extension. And the reason that we went with the Tomotherapy Center out there is because we really wanted to reach out to more parts of Colorado, and this really gives us the capability to bring in patients and have them have the ability to be treated at the Tomotherapy Center from places like Pueblo, Colorado Springs, Boulder, Colorado. So it's a very nice outreach program for us. Well,
this is exciting. We're talking to Dr. Rabin, who is studying tomotherapy, helping thousands of people suffering from cancer. 720-848-5400. Tell me more about your specialty, doctor.
So my areas of expertise, and I think this is another interesting and unique aspect of our faculty, is that each of us have specific areas of expertise. We're not jack of all trades. We don't consider ourselves fast food radiation oncology. Each of us spends hours and hours and hours in planning on specific areas. So my areas of expertise are in head and neck cancer and cancers like prostate cancer and bladder cancer. So I sit on national committees that help guide the treatments of these types of treatments, and majority of our faculty actually sit on national committees throughout the country and travel quite a bit to help design these treatments that can be delivered safely on the Tomotherapy Center and other types of linear accelerators.
It's so comforting to know that a doctor like you you're here in our own backyard. I mean,
That's
we can
great.
get in touch with you. And if there is somebody that's needing to reach out or needing to go through treatment, what's the best way to contact you?
Well, one of the ways to contact us is call the main center. It's 720-848-5400. There's always going to be somebody there. We pride ourselves on actually having human beings answering the phone.
Good.
And that's a very, very easy way to get in touch with us and at least come, to see us for a consultation. I think it's important to emphasize that it's not just the machinery. We think the Tomotherapy Center is an amazing, unique aspect of what we do. But I think it's also important to emphasize that we have probably one of the most experienced staff, from physics support to the dosimetrists, the radiation therapists, and to our radiation oncology clinicians, that allows us to give the best kinds of cancer care, because you've got to be able to understand the cancer before you can treat it.
Right.
So,
and with this, it's so precise with tomotherapy.
It really is. It's
right.
a fantastic new modality for us to offer cancer patients.
Thank you so much for coming on the show.
It's a pleasure.
I have to say I haven't heard of tomotherapy until today, so it's wonderful. The University of Colorado Hospital Tomotherapy Facility, again, is located at 10463 Park Meadows Drive in Littleton. Now, the University of Colorado Hospital System assures you of the utmost care and technology for various cancers. If you or someone you know are being treated for cancer, learn more about the tomotherapy by calling 720-848-5400. There's also a great deal online at uch.edu/tomotherapy. That's uch.edu/tomotherapy. The number again, it's 720-848-5400, and University of Colorado paid for this segment.